Welcome to Wednesday Wellness Debrief, your journey to wellness and maternal health. I'm your host, Brittany, and today we're tackling a crucial topic that can significantly impact pregnancy and their postpartum journey, preeclampsia. And we have a new segment called Track That Bill. If you're finding our content helpful, please take a moment to follow us on your favorite podcast platform, like this episode, and subscribe so you don't miss on any future discussions. Disclaimer, our aim with this episode is to offer a supportive space for learning and discussions about wellness. However, it's vital to understand that the information shared is not a substitute for professional medical consultation. We encourage you to use what you learn here as a starting point for conversations with your own medical provider, who can officially diagnose and develop a treatment plan tailored specifically for you. Welcome to our new segment called Track That Bill. We're shifting our focus to an incredibly important resource, the March of Dimes Bill Tracker. This tool allows us to keep tabs on key federal legislation that directly impacts birthing people and families in the United States. It also gives Brittany a reason to utilize all the skills and techniques she used for her master's degree. Try to keep that fresh in my brain. It's also a way for us to stay informed and to advocate for policies that are shaping maternal health care. So today, for Track That Bill, we're highlighting Connected Mom Act. So you might be wondering, what exactly is this bill? At its core, it is a bipartisan effort sponsored by Representative Louis Frankel of Florida, my home state, and Senator Bill Cassidy of Louisiana to improve maternal health outcomes by expanding access to remote patient monitoring technology. And another benefit, it directs the Center for Medicare and Medicaid Services to provide guidance and resources to states on covering these devices. And as we're seeing nationwide, we're seeing a lot of hospitals that focus on maternal health are closing down. This is the exact kind of common sense legislation that can make a huge difference by giving doctors the tools to monitor moms virtually. By giving doctors tools to monitor moms virtually, it can catch problems like preeclampsia, gestational diabetes early, potentially saving lives and giving families a peace of mind. I do want to give an update. As of January 15th, 2025, the Senate has read the bill and sent it to the Finance Committee. It's just kind of sitting in the Finance Committee. As of August 15th, 2025, this was introduced by the House and referred to the House Committee on Energy and Commerce, and I think it's still sitting there. We'll be using the March of Dimes Bill Tracker to follow the Connected Moms Act progress. And we will provide updates on how you can get involved, updates on this bill, and to stay informed. And it's a vital part of advocating for healthier and future of all families. And that was Track That Bill. Thanks, everyone. Let's get into the episode. I had an interview with a Take 10 ambassador from the Preeclampsia Foundation, Portia Holland Atumbe, on preeclampsia and the impacts of preeclampsia. And when my husband was listening to the episode, he's like, this was an amazing episode. What's preeclampsia? And I think I wanted to break it down a little bit. I also want to thank the Preeclampsia Foundation website for helping me research this episode today. I want to start with the official definition from the Preeclampsia Foundation website. Quote, preeclampsia is a persistent high blood pressure that develops during pregnancy or the postpartum period. It is often associated with high levels of protein in the urine or the new development of decreased blood platelets. In addition, trouble with kidney or liver, fluid in the lungs, or sign of brain trouble such as seizures or visual disturbance. End quote. So it usually begins after 20 weeks of pregnancy in women whose blood pressures have been normal. Now you're asking, Brittany, this is lovely. I love all these medical terminologies, but what is the cause of preeclampsia? And honestly, that has not fully understood, and research is still being done to figure out the cause of preeclampsia. But I do want to state most women with preeclampsia will deliver healthy babies and fully recover. Symptoms can vary. Preeclampsia is not a one-size-fits-all game. But I do want to state some common signs include, we talked about it, severe headaches, vision changes, pain in the upper abdomen, nausea or vomiting, overly sensitive to light, blurred vision, or seeing flashing spots in the front of your eyes, and swelling in the hands and face. Now, I get it. It's important to remember that some swelling is normal in pregnancy, but the sudden or excessive swelling in the face, your hands, your legs, that is a huge red flag. If you experience any of these symptoms, even mild ones, contact your health provider immediately, go to the ER. Early diagnosis and management are key to preventing serious complications for you and your baby. And again, I kept saying pregnancy and postpartum, the impact of preeclampsia extends beyond delivery. It can happen to any woman who just had a baby. So even if you did not have preeclampsia during pregnancy, you can still possibly experience it postpartum. So that's why it's so vital to remain vigilant. Even if it's not you, your partner, your family, your doula, your doctor, just keep that in mind as you're recovering. Climb is the world's largest event dedicated to raising awareness and understanding perinatal mental health disorders. The climb is more than just a name. It represents the uphill battle many families and professionals face every day. Our team is climbing to raise money to help make that journey a little easier. When you donate to our team, you're not just giving money, you're directly contributing to free resources for families and providing critical training for both clinical and non-clinical providers. Every dollar helps, gives families the support they need to ensure that those who work with them have the best training possible. And because PSI is a registered nonprofit, your donation is tax deductible. So please click the link to donate and join us in making the climb accessible in my backyard. Thank you. And how can you kind of maintain that a little bit? Recovery can involve continuing the monitoring of blood pressure, managing symptoms often, and emotional support. I will state having a blood pressure cuff is really important. I have one here due to my high blood pressure diagnosis last year. Having a blood pressure monitor cuff is really important. And if you don't have one, and I know financially it's really hard for a lot of people, please contact the Preeclampsia Foundation, reach out to your doctor, reach out to your insurance company. That's really important to help monitor yourself. And even the Preeclampsia Foundation, they have tracking sheets for you to track your blood pressure. So you can have that for your medical record and give that to your doctor for continuation of care. Many women experience a range of emotions from anxiety to disappointment, and it's essential to acknowledge and address these feelings. I'm going to leave the link in the description for the National Maternal Mental Health Hotline, the Preeclampsia Foundation, and the Postpartum Support International Hotline. If you feel the anxiety, disappointment, and you don't have that support system, please reach out to one of these resources because you are not alone. I don't want you to think you're alone. And hopefully, if it's not you, give it to someone who may be in need. For those of you that have experienced or are preparing for a C-section, our affiliate Pronatal Fitness has an incredible resource that can make a world of difference. Their comprehensive C-section guide is packed with expert advice, practical tips, and emotional support to help you navigate every stage of your C-section journey, from preparation and recovery to managing pain and embracing your new body. Honestly, I have a copy of it and I've been reading through it, and it offers really great insight that can empower you or maybe empower someone who is going through the C-section journey themselves. You can find the affiliate link for the Pronatal C-section guide in the show notes below. I highly recommend checking it out. And that's our show for today. Thank you for joining me as we discuss preeclampsia and highlighted a new segment, Putting My Master's Degree to Use. Remember, your health and well-being are paramount. If you have any concerns, always consult your healthcare provider. If you're enjoying these episodes, please tap the subscribe button wherever you listen to podcasts. Subscribing is completely free, and it's the easiest way to make sure our empowering conversations on maternal health and wellness show up in your feed every week. I also want to hear from you. What are your biggest takeaways today? Join our community on Facebook, Instagram, and TikTok at PVF_tribe, and let's continue this conversation. Until next time, stay strong, stay nourished, and stay well. Bye, everyone.